Hello and welcome. You're watching Health and Wellness, Save a Life. I'm Gargi Rawat. When it comes to heart disease in India, the statistics speak volumes. In the last 2 decades, heart disease has become the leading cause of death in the country, with a quarter of all deaths due to various cardiovascular diseases. Even worse is the fact that the disease hits us Indians in our most productive middle years. Most of the cardiac deaths are sudden and on the spot, but it is possible to prevent these sudden cardiac deaths if they receive immediate medical attention and CPR. Raising public awareness and understanding of the practical applications of CPR is an essential strategy to increase the success rate of CPR in cardiac arrest cases. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest, train them on CPR and highlight the role of CPR in saving a life. It's time we take our own heart health into our own hands and progress to become a healthier people. Today we have with us an eminent cardiologist who can help us better understand sudden cardiac death and the role of CPR. We're joined by Dr. S.N. Nagarajan, interventional cardiologist, Revati Medical Center, Tirupur, Dr. Nitesh Pansari, consultant interventional cardiologist, GP Shekhawati Hospital, Jaipur, and Dr. Siddharth Sethi, Senior Consultant Cardiologist, Director, CHCC, Kota. Thank you so much, doctors, for joining us on the program today. And Dr. Nagarajan, first to you, cardiovascular diseases are the leading cause of death worldwide, and they are also one of the most expensive diseases. Which cardiovascular diseases are preventable and which are not?
Good afternoon to all the senior cardiologists here at the dais. And I think, as spoken earlier, cardiovascular disease are a group of disorders affecting the heart and the blood vessels. It is estimated that almost 80% of cardiovascular disease, including heart and stroke, are preventable. That is, 1 in 3 of all cardiac deaths are preventable. So, coming into the risk factor as questioned earlier, so there are 2 types of risk factors, which are one which is modifiable and one which is non-modifiable. Modifiable in the sense things you can change, non-modifiable things you can't change. So, things you can't change are 1, age, the family history of any heart disease in your family, 3rd, previous history of any heart disease in you, and 4th, is the sex, either male or a female. I think male have more potential for developing a cardiac event, because females till their reproductive age they are being protected by the hormone estrogen, and after 45 years both male and female potential have same risk factors. And things which you can change, these are very important. These are the modifiable risks which we need to tackle, and which, if planned properly, can prevent you from a devastating cardiac event. The most important thing is your blood pressure, hypertension, which is a silent killer. Second and most common, now it's a pandemic, diabetes mellitus. And third, now the second pandemic is being on, that's called obesity, increasing your BMI. Fourth, exercise, lack of exercise. Fifth, dyslipidemia, cholesterol content, where we have an increase in LDL levels or bad cholesterol, and a decrease in the good cholesterol or HDL. Fifth is smoking, and the most important thing which you have is now is stress. I think these are some of the changes I think which can be modified by having a healthy diet, regular physical activity, and strictly avoiding from smoking. If these modifiable risk factors are being prevented, and this can make you feel very happy and have a good life expectancy. Thank you.
Right. Dr. Sethi, sadly it's become very common that younger and fitter people are also succumbing to sudden cardiac death. What could be the reasons for this?
Yeah, as Dr. Nagarajan said, sudden cardiac death is when death occurs within 1 hour of symptom onset, is called sudden cardiac death. This occurs due to an irregular heart rhythm. We call it ventricular fibrillation. It causes, that is, rapid erratic heart signals, leads to ineffective left ventricular contraction and leading to non-ejection of blood, that is, non-pumping of blood from heart. So most common cause is VTVF, that is ventricular tachycardia and fibrillations. But these occur secondary to coronary heart disease, that is heart attack. Less common causes are cardiomyopathies and genetic channelopathies. Cardiomyopathy related to obesity, alcoholism, and drug abuse are also increasing. That also causes sudden cardiac death. So to prevent these, we have, as Dr. Nagarjun said, we have to prevent all hypertension, diabetes, smoking, and good lifestyle, less stress, and training of CPR to general public, so that whenever anyone witness a sudden death, can provide primary CPR, at least primary CPR to the person.
Right, Dr. Pansari, now you probably wouldn't ignore a pain in your chest, but people often dismiss a pain in their legs, as there can be, several reasons behind leg pain, which are generally related to overwork and physical stress. Can heart problems also cause pain in the legs, and when do you know whether it is related to the heart?
Yes, you are right. Actually, most of the time what happens, the pain in the leg, the root cause of this pain remains in the leg only. Like if you have a muscle pull or some new nerve damage or some trauma to your leg, so you can have that pain. But if you feel pain on a regular basis, on a daily basis, when you walk or when you do some type of physical activity, then yes, it can be a sign of a wider health issue. And one of the most common causes is a peripheral artery disease, in which what happens that there is a development of a blockage or a atherosclerotic plaque in one of the vessel of your leg. And when you walk, the leg or the leg muscles do not get enough blood supply and it starts paining. So that is a common cause for which we have to look out. Then comes the second cause. The second cause is deep venous thrombosis. What happens is there is a development of blood clot in the vein of the vessel, in the vein of your leg. So it can lead to swelling, some discoloration in the leg or edema, and then can lead to pain in the leg. So that is all also a very worrisome cause of pain in leg. So most of the time what happens is peripheral artery disease is usually related to the coronary artery disease also. So you have to be very cautious if you feel pain in leg while walking, as well as you feel pain in chest also when you walk. So that is a double situation in which you have to be very cautious and you need to consult your doctor. So sometimes yes, the pain in leg can be a sign of a heart disease or can be a sign related to the heart problem.
Right. Dr. Nagarajan, what is a silent heart attack, if you could tell the viewers, and why do some people have silent heart attacks?
A silent heart attack is a separate entity. Heart attack is called silent when it has no symptoms or a mild symptom or symptoms which people don't normally connect to a heart attack. The importance of a silent heart attack is the important is that silent heart attacks are often fatal as a straightforward direct heart attack. Unlike what was thought before, there are symptoms of silent heart attacks which I think everyone should know about it. And three more common category where silent heart attacks are on an increasing trend are: one, women, ladies especially, more than 45 years. Second, elderly, both male and female, and those with diabetes and hypertension. These three categories we see more commonly a patient having a silent heart attack. And what are the symptoms normally they present with? They don't classically present with a chest pain radiating to both hands with sweating as such anything. They have some what is called an unusual presentation like the cold sweats, a typical back pain, either a jaw pain or a periumbilical pain, or a shortness of breath, and sometimes they can't describe a vague discomfort in the chest. They don't call it a heart attack, they call it as gastric discomfort. Most commonly presents with nausea or vomiting, and sometimes pain can be there only in the hands. These are some of the atypical presentation. The most common atypical presentation in diabetic is sudden sweating, and they feel easy fatigability, early myalgia with high sugars. Always keep a silent heart attack on the background. And people The vulnerable people, especially the elderly ladies, hypertension and diabetes, they should have a regular checkup, even if they have something, a new onset, a different symptom, not portraying as before. If they find any new symptom, kindly go ahead and to a physician or the concerned cardiologist. Keep yourself checked. Silent heart attack is as dangerous as an acute heart attack. Be cautious.
All right. Dr. Sethi, we all know feeling constantly stressed could increase your risk of heart and circulatory disease. How can acute stressors lead to sudden cardiac death?
Yeah, it is very common that negative emotion affects our body. Everybody knows. So stress, negative emotions, higher level of anger and stressful life event predisposes one to acute coronary syndrome, that is heart attack, and it may also predispose to sudden excessive rise in blood pressure, sudden heart failure. All these conditions may lead to arrhythmia, that is what I told earlier, ventricular fibrillation, which causes sudden cardiac death. So also sometimes unaccustomed physical stress may also produces this event, as unaccustomed physical activity also produces negative effect on the body. And also most common, sudden death is most common with underlying cardiac diseases and ongoing cardiac problems. So patients and persons should avoid negative emotions, hatred emotions, which is common in today's words, and higher level of anger. One should practice calmness and should be thankful to God and to the whole of the world. If we increases thankful emotion, then we can certainly reduces cases of sudden cardiac death. Otherwise, it will go on like this.
Right. Dr. Pansari, many people get confused about heart attack, cardiac arrest and heart failure. So can you explain these differences to our viewers?
Yeah, sure. Actually, this is a very common question which we face as a cardiologist. So what happens if we talk about in simple terms? So heart attack is a problem related to the circulation of the heart, and cardiac arrest is a problem related to the electrical current of the heart. And if we talk about heart failure, then it's a mechanical problem of the heart, like the pumping capacity of the heart. So heart attack basically it occurs when there is a development of any blockage or a plaque in one of the vessels of the heart, and it leads to decreased blood flow to the heart muscle, and it starts dying. So you feel a typical kind of chest pain in the middle of the chest, back pain. You can experience a jaw pain, profuse sweating associated with shortness of breath, and so this is a very emergency situation. And in this situation, you need to rush to the hospital. You need to chew a tablet of aspirin if it is available with you, and immediately you undergo ECG, and the doctor asks you to go for an angiography and the further procedure if it is required. And it is a life-saving, technique for the patient. Then, if I talk about the cardiac arrest, so in this, what happens? The heart stops beating, and we need to restart the heart. So, commonly, what we see that heart attacks do not lead to cardiac arrest, but yes, the common cause of the cardiac arrest may be a heart attack. So, in cardiac arrest, there is electrical disturbances, so the heart rhythm is not there, and we need to start CPR for the patient, or if a defibrillator is available, then we need to use the defibrillator also if there is a ventricular tachycardia or ventricular arrhythmia. So cardiac arrest is a life-threatening situation, and then this can lead to death within minutes if it is not resolved immediately. Now, if I talk about heart failure, then it is a pumping problem of the heart. So the heart is not able to pump as much as blood which the body needs. So there is a accumulation of the fluid in your leg, and you feel breathless. And most of the time, this heart failure is a chronic problem. Like it takes some months or years to develop. But yes, there are some causes in which you can have acute heart failure. So the heart failure patients, they start feel dizzy, they feel fatigue, there is swelling in the leg, and these are the common signs of heart failure. And the common causes of heart failure, again, heart attack can lead to a heart failure over a period of time. Then uncontrolled hypertension that can lead to heart failure. if you have any thyroid problem, any chronic kidney disease problem, if you have any heart valve problem like mitral stenosis, there are some heart valve issue which can lead to heart failure in the long term. So these are the basic differences.
All right, with that, we'll slip into a short break, but don't go anywhere. We have more questions to ask the doctors, so do stay with us. Welcome back. You're watching Health and Wellness, and we're talking about heart health as well as CPR and certain interventions. Let's go back to our panel of doctors. And Dr. Nagarajan, if you could talk to us about CPR, why is it important during heart emergencies?
Thank you, and asking for me about this question. It's a nice question, and the whole concept of saving a life, the educate, act, and revive, all depends on this main concept called CPR. CPR is called a cardiopulmonary resuscitation. It is critical whenever you do it on a patient it is done on a patient who is unresponsive. You find the patient who is unconscious and unresponsive, you are deemed to do a CPR. If the most important thing is, if you do a CPR immediately, it can double or triple the chance of survival from an out of hospital cardiac arrest. So don't ever hesitate to perform a CPR if you see someone unresponsive or falling unconscious. Few things, very important things. How to perform CPR is very important. Whenever you find a patient unconscious and not responsive, first thing you do, check his response. Not responding, kindly check his carotid pulse. If the carotid pulse is absent, kindly take the patient to a nearby safer place, make him lie on a concrete ground, and start performing your CPR, cardiopulmonary resuscitation. So you can take the palm of your hand, one hand, and press the chest with the heel of the palm of the other hand. For an adult, you have to press down at least 2 inches. And you count around 30 compressions per minute at the rate of 100 to 120 beats per minute. You keep compressing it. And for an infant of 1 year age, use 2 fingers, 2 of your first 2 fingers, and press just 1.5 inches. For adults and children, you can press till 2 inches. And for infants, compress it for 1.5 inches. So by doing a CPR, what do you actually perform? So you are just stimulating or artificially creating your normal systolic and diastolic place in the heart. That is your compression and relaxation, contraction and relaxation of the heart. So whenever you compress, what you do, you give direct pressure over your right and left side of the ventricles. So by directly compressing your right and left ventricle, you push the blood from the heart into the circulation. Most commonly it goes into your brain because that is the first part which gets directly from the heart. So your brain, by doing a CPR, you at least give blood supply to your brain so that you become conscious. That is the main aspect of doing a CPR. And when you release, after compression you release down. When you release down, your ventricular pressure decreases and you see your ventricles getting filled up blood again from the veins. So by directly compressing and relaxing, you create an artificial systole and a diastole. Elastic recoil of the chest and heart between compression creates a negative pressure so that blood is sucked into the heart during your relaxation. So whenever you see a patient or any of your friend or any unknown attenders to having a sudden unconsciousness and unresponsiveness, kindly perform a CPR. CPR is not only for medical people, even a non-medico can learn, and it is good to learn CPR so that they can save many lives out of hospital cardiac arrest.
Right. Dr. Sethi, now there's always a fear, however, during CPR that if a person giving CPR is not well trained, that he could actually instead cause serious damage to the patient. Does India have a clear law on this, and what is the liability of a rescuer when attempting resuscitation?
Yeah, it's a common belief that if we give it inappropriately CPR, then we can harm the persons. But anyone who witnesses a sudden cardiac death can give CPR, whether trained or not trained. As in CPR, only time to start CPR is the most important factor in saving life. If one is alone, then should call for help first.
Right. Dr. Pansari, if you can tell us what happens if CPR is not done correctly, is done incorrectly?
Yes, sure. See, CPR is basically a life-saving, technique which can save a life. So what we say that even a bad CPR is better than no CPR. So first of all, you need not worry that you can, give some trauma to the patient on which you are performing CPR. So yes, CPR can lead to save a life, but there are some side effects or some things which can, cause damage. So the most common side effect of CPR, I would say, is a fractured rib. So suppose if the patient on whom the CPR is getting performed, the ribs are fragile or the bone is weak. So whenever you give the chest compression, there is a definite chance of breaking the rib. And this broken rib sometimes can lead to, laceration to your lung, or it can injure your liver or spleen rare of the time. So this is one side effect of CPR. Then the other complication I would say of CPR is a pneumonia. So there are some secretion in the patient's mouth, or he has done vomiting just before getting unconscious, and you have started performing CPR. So this vomiters or these secretions can get entry into his trachea, and on a later time it can cause pneumonia for that particular patient. Then if I talk about the other side effects, then the third one is brain injury. Whenever we give compressions, we try to compress the heart, and it will pump the blood and it will reach to the brain. But there is not enough supply of the brain or oxygen, not enough blood supply of oxygen to the brain. So it can cause some hypoxic damage to the brain or a later period of time. Then, so basically these are 2-3 side effects of CPR, but this should not, tell us that we should not give CPR to the patient who is going to die. So first of all, we need to give CPR to the patient without thinking about these side effects, because these are side effects which can be managed later when you try to, you spontaneously recover the patient after a CPR. So these are the some side effects of CPR.
All right. Dr. Sethi, what is the role of cardiac rehabilitation post-angioplasty or bypass surgery? Do home cardiac rehabilitation, is that possible?
Yeah, role of cardiac rehabilitation is to limit psychological and physiological stress associated with heart disease. As most commonly, patient with heart attack and post-bypass worry about their activity, what to do, not to do. So physician should guide them about their activities, what to eat, not to eat, how they can improve their functions, and how to increase graded exercise so that they increase their cardiovascular function and longevity of the persons. Cardiac rehabilitation also can be done under the physician guidance at home. Basically, home is more important, as in the hospital, patient comes to us and we advise some exercise or whatever. But if home monitoring can be done, then it is better than the advice, as one can judge whether patient is doing fine or not, or need to increase his activity or not. So cardiac rehabilitation is the major factor after a heart attack and bypass surgery or post-angioplasty, to increase his stickness to the medicines, to his physical activity, and for his well-being. So this is the most neglected part in India, as patients generally do not care about this, or basically they are not aware of the gain of the cardiac rehabilitation. So every patient should ask to his physician that what should I do on what should I do not do after angioplasty and bypass.
All right. Well, thank you, doctors, for taking time out and talking to us about these very important issues and raising awareness about heart health. Thank you all for watching at home. Goodbye.